Well, hey, welcome to Chapter 8 in the second edition of Transformative Nursing in the NICU, Trauma-Informed Age-Appropriate Care. My name is Mary Coughlin. I'm a neonatal nurse practitioner by training and the president and founder of Caring Essentials Collaborative and the author of this book. We're now on to Chapter 8 within the core measures section. Chapter 8 looks at protected sleep. And the similar convention that I've shared with you in previous chapters when looking at the core measures, I basically open the chapter with kind of this overarching information, latest science stuff about what sleep is or what that particular core measure is. And then I dive into the applications of, for this chapter, sleep with regards to the clinician, sleep with regard to the family in crisis, and then wrap up the chapter with a discussion about the relevance of sleep and the critically ill infant. So this chapter opens up with just really kind of clarifying, what am I talking about when I say sleep? And I use the, I've included here the definition from the National Institute of Mental Health that defines sleep and wakefulness as endogenous recurring behavioral states that reflect coordinated changes in the dynamic functional organization of the brain and that optimizes physiology, behavior, and health. What we know from research is that sleep health is influenced by genetics, disease, lifestyle, and so on. And so what I've really uncovered in my appreciation of sleep that has really evolved over time is that without adequate sleep, we are threatening our health emotionally, physically, our capacity to function optimally, our capacity to engage in meaningful relationships, and that there's lots of different things that can perturb our sleep and impair the quality of our sleep. And particularly, I do kind of dive in, especially talking about the influence of shift work on sleep and how that really poses an additional challenge to clinicians, to professionals who work rotating shifts in maintaining optimal performance and optimal health as well. So there's a really cool assessment tool that I uncovered called the SATED scale, and it talks about these different dimensions of sleep. And these 5 relevant dimensions include duration, efficiency and continuity, the ability to fall asleep and maintain sleep, the timing of sleep, whether or not the sleep when we wake up makes us feel refreshed and alert, and do we, just from a qualitative perspective, feel satisfied with our sleep. And I just kind of describe each of these different dimensions in this introductory phase. And then what was really cool, this was the most current reference that I could find, but in 2015, the National Sleep Foundation has a list of sleep duration recommendations that I thought was really helpful to include in this chapter. And it goes from newborns. It doesn't, discriminate, preterm newborns or full-term newborns. It just says newborns. And I'll explain a little bit more detail when I talk about the infant with regard to that age group. Then infants, toddlers, preschoolers, school-age children, teens, younger adults, and older adults with, again, recommendations. Because again, we don't know what's ideal, but we know based on some of the studies when we look at shift worker, when we look at operating under the influence of sleep deprivation is very comparable to operating under the influence of alcohol or drugs. Our judgment, our impairment, our response time is all significantly impaired when we don't have enough sleep. In addition, that sleep deficit adds an additional physiologic stressor on our body. And if you've been paying attention and following the series, you'll understand that these types of stressors then activate endogenous stress responses, activate inflammatory mechanisms, and all of that can confound and contribute to increases in morbidity and increases in ultimately mortality. There's a really great YouTube video out there, and oh gosh, now the guy's name is totally escaping me, and I'm so sorry for this. Oh, you know what? I have it in the reference section of this chapter. What happens to your body if you don't get enough sleep? Oh, I didn't put the author's name down there. It'll come to me. Okay. So hang with me as I kind of walk through this. But I think so often we really minimize the impact and the urgency of sleep on our overall health and wellness. I can say that as a former night shift nurse. I mean, I spent years, years and years working the night shift. And it wasn't truly until I flipped into days that I realized how bad I felt on a chronic level, that my capacity to engage with my children, feel energized, do exercise, enjoy my life was impacted by my shift work and my inability to really kind of figure out then, how do I create ideal and optimal sleep hygiene routines that will help me overcome some of these challenges in working being a shift worker. So I kick it off after this kind of general overview, and dive right into sleep and the clinician. And as always, I always identify what the attributes are of each core measure. The attributes for the protected sleep core measure for all, for clinician, family, and patient, baby rather. It's about sleep integrity and circadian rhythmicity are protected, that strategies to support the sleep are an integral component of hospital care or the individual's daily routine, and that safe sleep practices for infants, families, and clinicians are adopted and role modeled. And you might be thinking, well, what are safe sleep practices for clinicians? I mean, I get safe sleep for the baby, although we're not really good at it. Well, safe sleep for clinicians now, based on a recent report from the Joint Commission and even ANA, the American Nurses Association, is recommending nap time, like, recognized, honored nap time for shift workers, having us not, go find a chair or a corner and curl up and try and get comfortable, but actually creating spaces for clinicians that work shifts to get those little power naps to rejuvenate themselves. That the research now is demonstrating that individuals that are able to take naps, and that the naps are recognized. So, because that's the other piece from the research that I gleaned that I thought was wicked interesting, is that there are places that say, oh yeah, sure, go take a nap, and there's an extra patient room there or something like that, but don't tell anybody, because as at least as a nurse, that's really frowned upon, and you're abandoning your post, and pretty significant harsh language. And what Joint Commission, ANA, and the research is really telling us is say, okay, not everybody needs to take a nap. Not everybody wants to take a nap, but everybody does get a break, and work through creating something that's, that there's equanimity in how people do this, because we can get really weird, on night shift, like, well, they get, these kinds of breaks, and I just take my coffee break, and they're getting extra time off, and I'm not getting time off. Look at this, discuss it, figure out how it can work best for everybody. Because what the goal is to optimize the functionality, the performance, the health and wellness of the clinicians. And so if you're, what, I'm going to forgo my coffee break, and instead of doing a coffee break, I'm going to go into the nap room, and everyone knows, and I've signed off my patient, and this is what's happening and stuff. And then I feel refreshed. Maybe for someone else, what, I'm not really good at a power nap. It makes me feel actually worse. So I'm going to take a break, and I'm going to go run up and down the staircase, the brightly lit staircase. So there are these different strategies that can kind of trick your brain into getting re-energized, refocused. So they talk about light showers. There's napping is one thing. They talk about light showers, going into a brightly lit room, and that kind of fakes out your suprachiasmatic nucleus, and thinks that you're daytime, and that gives you like a jolt of energy. And usually we have these nadir moments, I think that's the right word, usually around 4 a.m, where our cortisol level is like falling through the floor. And, again, you're just really exhausted, and you can succumb to that basic tendency for your physiology to fall asleep. This is normal. This is mammalian biology. And so we need to figure out how to navigate that in healthy ways that don't, that don't demean, that don't harass our colleagues, we're trying to work together. And so that's what I was really trying to get at in this section, specifically with the clinician. And even just as a side to follow up on that, for folks that have long commutes, home, maybe having a dedicated space for staff to take that power nap before they go home. Because again, we know driving home after a night shift, you're incredibly vulnerable to falling asleep at the wheel and then having some catastrophic event happen. So, just really being mindful of this. There was a really great paper that I included in the chapter, and it was by James et al. 2017, and talks about shift work, disrupted circadian rhythms, and sleep implications for health and well-being. And it identifies these 4 domains of health that are adversely impacted by shift work: mental health, heart health, metabolic health, and even cancer. And that YouTube video that I was talking about really talks about how sleep deprivation and sleep debt has been linked to cancer, has been linked to obesity, has been linked to diabetes and hypertension, and mental health challenges. So we have the research there. We just need to take that information and then strategize. We're super creative people, come up with ways that we can address this and mitigate fatigue-related errors and even death in our clinician colleagues who are operating under the influence of extreme fatigue. Okay, so yeah, that's all of that there. And then I share these evidence-based strategies with you. I mentioned the SATED questionnaire, and that's really just kind of a check-in. We actually had a gal just recently from our trauma-informed professional certificate program, again, because, we go over the book and we talk about the core measures. And when she did her assessment on herself for the SATED scale, and it takes like 3 seconds, it was kind of like an aha moment, and saying, gee whiz, you know what? I am always tired. I'm terrible at sleeping. I always put my sleep as the lowest priority on the list. And she was having some health challenges as a consequence, but she hadn't put 2 to 2 together. She went and spoke to her PCP, and they came up with this really good strategy, and it became top of mind. And I mean, who wants to die early in life because you didn't get enough sleep, because, as a consequence of the toll that the sleep deprivation takes on you. So I have down here, the Joint Commission's initiative, the ANA's initiative, and a position statement, actually calling for collaboration between employers and nurses to reduce the risk of nurse fatigue and the sleepiness associated with shift work and long hours. The ANA urges the implementation of evidence-based strategies to proactively address nurse fatigue and sleepiness. And I think certainly that's even more paramount now in the this wake of the COVID pandemic, where nurses have been picking up extra shifts and working at a higher and higher sleep deficit. And we're seeing the consequences, and the nurses and the clinicians are feeling the consequences, and their families, and so on and so forth. So again, it's just really important that we pay attention to this for ourselves, because from my perspective, in working through this idea of trauma-informed care in the NICU and beyond, I feel if we can find the relevance of these core measures, these core needs, human needs that are universally requisite for health and wellness, if we as the carers can get a grip on it, can understand its relevance for our own lives, then it opens up our hearts, opens up our minds to then see, gee whiz, this is really, if this is important for me, and I'm a human being, then what about these poor guys? They're humans too, and they're just in the throes of catastrophe. Maybe this is important for them too. And so I transition from that mindset of addressing this with regard to the clinician to then talking about the implications for the family. And again, I was kind of struggling with how to articulate this in the chapter, but I kind of came to the place where I thought, well, the family members, the parents, they're adults too. I don't know what their backstory is. I don't know if they're shift workers. I don't know what their sleep practices are. So a lot of the stuff that I describe with regard to the clinician may very well have implications for the parents. But then, diving deeper into, being a postpartum mom and the sleep needs and the sleep deficit that you have as a consequence of that. And just, the challenges of gestation, right? The challenges of being pregnant and getting optimal sleep. And then the stress and the fear and the anxiety that also robs you of quality sleep as your baby is now in the precipice of life and death, and you're trying to pull it all together and figure out how are you going to address this. So recognizing that. And then also, I'm on a roll now. What popped into my head was, how many of my colleagues get like all freaked out when, parents are kangarooing skin to skin, providing skin to skin care for their babies, and they fall asleep. It is biologically near impossible to not fall asleep, because in the act of snuggling up with that brand new human being and being flooded with all the feelings that you feel, in love with that new person, you also have this super outpouring of all of these neurochemical peptides that actually induce sleep, induce comfort, make you feel connected. And so parents are going to fall asleep just by that alone, and then throw all of the superimposed stress, sleep deprivation, worry, fear, maybe pain, onto the pie here, then obviously they're going to be very vulnerable to falling asleep. And what do some of my colleagues do? They're like, well, we can't let you kangaroo because you're going to fall asleep. Instead of looking at that and trying to have people fight against their own biology, maybe we have an opportunity to look at creating safe spaces, safe sleep situations and setups, where then we can offer this incredibly profoundly beneficial evidence-based intervention for babies and families in a safe setting, and not just dismiss it as, I don't have time for that, and we don't have the resource, and blah, blah, blah. Make that a priority. And just think about the benefits, when you just think about all of the research that is out there. I do kind of dive into some of the mental health challenges, right? Remember when I mentioned that the 4 domains of health that are impacted by sleep deprivation, mental health was absolutely one of those. And so, mothers of hospitalized newborns experience both nocturnal sleep problems and disturbed circadian rhythms. And it goes on to talk about how this poor sleep quality in mothers of premature infants has been associated to depression, post-traumatic stress disorder, and other types of mental health challenges. So, just recognizing that their story, their experience of this crisis is also impacting their health and wellness, and how they're able to show up for their baby. They obviously absolutely want to show up as their best self, but they're in the throes of their own physiologic crisis and emotional and mental crisis as well. I mean, a lot of the babies that are admitted into the NICU are admitted as a consequence of some acute life-threatening event, whether it's, prolapsed cord, or, premature rupture of membranes and chorioamnionitis, or, unplanned cesarean sections, all of these other things that happen to these individuals that make them feel powerless and overwhelmed and overwrought, rob them of healthy sleep. And so how can we figure out how to nurture that, how to support that in meaningful, measurable ways? Do we have the resources? Maybe some of our, I'm speaking as a nurse now, maybe our, developmental therapist team can help us. The neonatal therapist can actually help, or child life, or other folks, because a lot of these strategies to help improve sleep in NICU parents certainly would help us as well. But they talk about skin to skin care, aromatherapy, sleep hygiene practices. And what's sleep hygiene? Those are the routines and rituals that we create for ourselves that help us, kind of wind down at the end of the day. What are those things? Like maybe taking a bath, or doing a little reading, having a massage. What are some of the others? Guided imagery, muscle relaxation techniques, meditation techniques, and that sort of thing. So maybe I slept great my whole entire life, but you throw me into a traumatic situation, an absolute crisis for my family, and all of my, reasoning and my rationalization, it becomes all foggy because I'm operating at this subcortical level. I'm operating at that fight or flight survival mode. And I can't even think about how I can help myself. So I turn to you as clinicians, as my healthcare providers, to guide me. And so that's what I've included in this section, looking at sleep, protected sleep for the NICU family. And then I transition into sleep in the hospitalized infant. And we're finding more and more amazing research to help inform us on how we can best protect sleep for these individuals. We still struggle, but again, understanding that, remember when I said about the sleep recommendations and the sleep recommendations for a newborn infant. Now, this was from, I'm just flipping back to the pages, the National Sleep Foundation, sleep duration recommendations, newborns. When they talk about the recommendation for 14 to 17 hours a day, they're looking at healthy term people. What we now know from the research is that the more immature you are, the more sleep you need, the more time you spend in sleep. And the sleep state that you spend the most time in is actually a state that's called active sleep. That's equivalent to REM sleep. So the more immature you are, the more time you spend in active sleep. And then as you approach full term gestation, it becomes kind of like 50-50. It's not exactly 50-50, but it's 60-40. I'm making it up, but you actually end up spending, kind of a 50-50, we'll say, between active and quiet sleep. And then there's a transitional sleep between, as you switch states. And then postnatally, at that first month, it starts to move to 60-40, with 60% quiet sleep and 40% active sleep. And then you have that differentiation into non-REM, and then the 4 substages of non-REM. And then REM sleep becomes a smaller and smaller component of your nighttime sleep. So, when we're taking care of really incredibly immature people, though, we have to understand that, right? It's not that, REM sleep is less important than quiet sleep. They're both very important. But when I think about the fact that REM sleep over time is going to diminish, I'm going to try and protect that as much as possible, because I know that there's a lot of really important brain development, brain architecture, brain growth and development happening during that REM sleep, and the quiet sleep as well. But again, just really understanding that. There was a great paper by Bennett et al., published in 2018. It's the title is "Waking Up Too Early: The Consequences of Preterm Birth on Sleep Development." It's an absolutely phenomenal paper. And then there was a subsequent paper that I absolutely loved by Dr. Barbeau and Weiss, 2017, talking about sleep disturbances in newborns. And she's the one that has this really cool graphic that shows you like active sleep and the transition to quiet sleep. So for me, at least, understanding that is really helpful to inform then how I'm going to engage with the patients. I've talked about this paper before. Levy et al. Did this secondary analysis looking at polysomnographic recordings of babies in the hospital. In the secondary analysis, they were looking at hands-on care. How does hands-on care connect with the sleep state of the baby? And it didn't. Like hands-on care is done at 8, 11, 2, 5, or whatever the schedule is for the baby. And it has no bearing on what the sleep state is. And so we know that, right? But what these folks were able to then demonstrate is when you do your cares that way and you're not paying attention to the sleep state of the baby, particularly when they're in active sleep, that disruption of the sleep actually induces hypopnea, apnea, and oxygen desaturations, respiratory disturbances as a consequence of your hands-on care without regard to the baby's sleep state. So that brings me to just this really interesting work around assessing sleep-wake states. And now, many, many years ago, I had developed this super simple tool. I called it the what did I call it? NeoSWAT, neonatal sleep-wake assessment tool. And I kind of mirrored it after the PIP pain score, right? It was 0, 1, 2. And I looked at the literature to find out what behaviors have been associated with what sleep state. And that identified my indicators. So I basically have eyes, respirations, facial expressions, and motor activity. And then just described, for 0, this is what you see. 1, this is what you see. 2, this is what you see. And for a score greater than 6, the infant is usually awake or waking. So, but most recently, like literally just January, and it's just February, right, end of February, I was able to come across this really, really cool paper by a team out in Utrecht, the Netherlands. I can't remember all of the authors, but Dudink was one of the authors who actually was a speaker at the Science and Soul conference that we held in Bruges back in 2019. And he's a nerd sleep researcher, and he's an neonatologist. And they developed this sleep assessment tool that's really refined. I don't know how, it is probably a little bit of an education curve for it, but I'll put the reference down below here underneath this YouTube video, and you've got to check it out. I believe it was an open access paper. Just really interesting, because again, the more that we can integrate that assessment piece, unless you're doing continuous brain monitoring, and then you can tell when the baby is, coming out of their sleep state. I think having the skill set to identify those behavioral and physiologic manifestations that suggest where is the baby in their sleep cycle, that really can help us be less disruptive, be less traumatizing to these individuals, create less sleep fragmentation and less sleep deprivation. I also included in here, again, because there's just been so much fantastic research, looking at the relationship of feeding behaviors and sleep. And was it Park? Yeah, I'm just looking here. Park et al. Was able to demonstrate that babies that had immature or dysmature feeding behaviors actually would benefit from more protected sleep, because it is in the protection of the sleep that facilitates the brain maturation, that then prepares the infant to be able to be more coordinated, more awake, more alert. You can't force it though, right? So it was a really cool study helping us, and I'll try and remember to do that, or just get the book and look at the chapter. But it was really, it's really important for us to understand that rhythm. If you think about a healthy full-term person, right? What do? They sleep, they eat, they sleep, they eat, they sleep, they eat, they sleep, they eat. It's just how they are programmed to develop, right? And so I think of my babies, and I was a breastfeeding mom, and obviously they feed a lot, but that's what they do, right? And it's the feeding that, and then they fall into their sleep state, and then the sleep, all of the brain activity, brain development, maturation, organization of experiences, all that stuff is happening. And then they come to another awake state and they eat a little bit. And then as they get more mature, it's not just eating and sleeping that they do, it's eating, engagement, maybe play, and then they sleep, right? And so you see this evolution that gives you that understanding of the evolving bandwidth and growth and development of the brain as they're able to spend more wakeful time engaging with the environment. But they can't do that if they're sleep deprived, if they have that sleep deficit, and that deficit impairs the complexity of the networks, right? The neuronal networks aren't fully mature, aren't fully developed. And it's also confounded by traumatic experiences. When you look at the relationship of pain and sleep, if I'm in pain, it's really hard for me to get to sleep. And so that's the other piece as we move through these chapters of the core measures, and you move through this book. I mean, I present them linearly, right? Because how else can you present the content? But it's not for you to think of them linearly, but super integrated. So we've talked about the healing environment. We've talked about compassionate collaborative relationships. We're now talking about sleep. The next chapter is pain and stress. They're all integrated, right? A nice, quiet, healing environment with low lights and quiet sounds facilitate my ability to go to sleep. Pain management, effective pain management helps keep me comfortable so I can fall asleep. When I get into ADLs, having me in a posture that is comforting and soothing and reassuring helps me fall asleep, helps me feel comfortable, helps me feel less stressed, right? So you start to really understand the integrated nature of these core measures. And then at the very end, I just added the most recent table from the American Academy of Pediatrics talking about safe sleep recommendations, because of course you just have to have that. And unfortunately, we do still struggle with role modeling and teaching parents about safe sleep practices in hospital and at home. And I do talk about some better practices in facilitating that transition. So I hope that this was helpful. I hope this was interesting information. Just like all the other chapters, I have, a couple of reader resources looking at, Ariana Huffington's sleep resources. She's a great resource. At least I think she's really awesome. The National Sleep Foundation Sleep Diary. That's something that could be helpful for us as clinicians, as just adults, and for families. 7-minute bedtime yoga practices, again, for parents, for us as well. And then what happens to your body and your brain if you don't get enough sleep? Just really important resources, along with just, pretty standard reference list that's very, oh my gosh, that's a long chapter, long reference list. So really good reference list. So thank you so very much for spending your time with me. I hope you found this interesting, and I hope you'll come back and check out the next installment of this core measure YouTube series, when I'll be talking about the core measure of pain and stress prevention, assessment, and management. In the meantime, you guys take care and care well. Thank you. Bye.